Good morning, everyone. Thank you for coming. I think we'll go ahead and get started, even though I would anticipate a few more people might come in. Welcome this nice hot July day. My name is Mindy Tuller. Yeah, actually, go ahead and look that small and this is big. My name is Mindy Tuller, and I manage the Medical Home Portal, which is actually one of the main topics of our meeting today. And I also facilitate this meeting. I work for Dr. Chuck Norland, who's in the back, and he'll introduce himself, as will we all. If you don't mind, we'll go around and do introductions. So maybe we'll ask Kate to introduce herself first so we don't forget about her. She's on the phone.
Kate, can you unmute yourself and introduce yourself? Okay, go ahead.
She says hi. Thank you for saying hi on the meeting. Okay, so Kate is she has a more official title than care coordinator. I don't know if she'll take that in for us, but she's at the primary Intermountain.
She's the QI outcomes analyst for the IHTC.
That's
Primary Children's Hospital.
Yeah.
Thanks, Kate.
Great, thank you, Kate. Oh, and I lost this kind of. Okay, well, we can do introductions while we're waiting for that. Okay, so Debbie, do you mind?
I'm Deborah Hobler. This is my first time to the meeting, and I'm care coordinator for Pediatric from Prevalence.
Oh, welcome.
And I'm Margaret Davis. I am nurse consultant with Sacred Circle Healthcare, which is an Indian-run healthcare clinic, but it's open to all Medicaid, downtown Salt Lake.
Welcome.
My name is Gabi Baragoshi. I'm a QI specialist with UPIC. I'm working with Dr. Chuck Norlin and Don. Kim is not here yet.
I am Colin Kingsbury. I'm the Autism Systems Coordinator for Children with Special Healthcare Needs.
I'm Jan Boker. I'm the nurse care manager at Memorial Pediatric.
I'm Dawn Bentley. I'm one of the QI coaches with UPIC with Gabby.
And when she comes.
I'm Carol Long. I'm the nurse care manager at Prevalence.
I'm an advocate. I'm with Baby Nursing Center for Recovery, which is a mental health and substance abuse recovery program for adolescents over 17, 18, and higher.
I'm Commissioner Ryan James, Center for Recovery on Children with Special Healthcare Needs. I'm a government. I'm the manager at Outreach. I'm Emily Thompson, culture at the Outreach.
And Ron with Wasatch Pediatric. I'm the behavioral health coordinator.
Katie Haynes, I work with the Medical Home Portal.
Chuck Martin, director of driving.
I'm Maria Castro. I'm the medical assistant care coordinator at South Queensland. We had your care coordinator, one of the care coordinators at the clinic. I'm Rebecca Barker. I'm the other care coordinator at
Great. Great. Okay, we have a few more people coming in. I won't put you on the spot quite yet. We'll just sign in and grab a seat. But welcome, everyone. It's great to have some new faces here, too. And I'm delighted to see so many of you here on a July meeting day. We weren't sure what kind of turnout we'd get with vacations and that kind of thing. So fantastic. So we'll go ahead and get into our usual brainstorming time. And I lost my other window here, so let me bring that back up. So for those of you who are new, we always use a few minutes at the top of each meeting to talk about any hurdles, any issues that folks are having trying to find resources and things that their patients and families need. Alternatively, we also talk about any new resources that we're aware of. We share information back and forth. We look for help from each other. If we're running into hurdles to try and connect the people we work with the resources they need. So this is your time to talk about that. You can also share with us any of your wins. If you had an opportunity to really make a difference and help families connect to things, we like to hear about that. We love to hear about whether you've been able to put motivational interviewing skills into your daily practice. We also love to hear if you've been able to help with QI improvement with your organization, all of those kinds of things. This is your time to talk about that. So hopefully you'll feel like you can ask some questions of your colleagues or let us know some positive things that have been going on. So anyone?
Well, I'm not shy. I'm really new at my role, and I am doing QI with the Sacred Circle Healthcare, trying to bring them into compliance with everything and get them accredited. In the 2 months I've worked with them, I think I've started 5 QI projects.
Wow.
Because there is a lot to do, and we've restructured the whole clinic. Quality improvement is so important in the care that we give. We've started doing psychotherapy and a pain clinic as well as primary care. So there's a lot going on in the clinic. They're going to be bringing in their own integrated lab. They're going to be bringing in their own dental and specialists for the underserved population in Salt Lake.
Wow, that is fantastic.
So it's busy.
Yeah.
Would you like the name of your clinic?
It's Sacred Circle Healthcare. I bought flyers. I'm kind of doing some marketing for them too. Sacred Circle Healthcare, and it's just on 6th South and 2nd East. And like I said, we have 3 primary care doctors. We have the pain clinic that comes on a Friday right now, but they'll probably be expanding. We have the psychotherapy, mental health portion, not just for the pain clinic, but for all and all problems. We do service a lot of children in our clinic and do very well with those. Because we're an Indian health clinic, we want to service Medicaid. We do service the Indian population, native population in the valley, and we do also service the uninsured. So we have a full pharmacy on site as well. We have the lab on site, and like I said, we are expanding. So we do a lot of stuff, but getting people up and running the way they should be is interesting. It's interesting.
That's great, Margaret. How does your clinic handle the uninsured?
The uninsured, we do have a self-pay. We are looking at the possibility of doing a sliding scale. We service a lot of refugee clinics, a lot of the refugees. We do the initial screenings for them. So we do have Arabic speaking on staff. We do have Spanish speaking on staff, and of course, I'm the only English speaking. So we have American speaking on staff. We just do the whole gamut of everything we possibly can to help them. We do the children's immunizations, and all of that is, of course, is free for the children.
And what are your hours?
We are open from 8 till 6, Monday through Friday. The pain clinic on Friday can start as early as 6:30 in the morning. So, yeah.
Fantastic. Oh, that's great. Okay. We'll make sure if you're not already in our portal database of local service providers that we'll get you in there. And that's fantastic. Anybody else? Wins? Hurdles? Everything's going great, right? No problems whatsoever. Okay, all right. Well, that's fabulous. We'll go to our next slide.
Mindy, this is Gina. So just one thing that I know the hurdles that do come up for all of you are when families get denied Social Security, the SSI piece of it. Whereas now they have just implemented an online appeal process, so that makes it so much easier to help the families and the families to go on versus having to go in and out the papers. So they just barely advertise that this week.
So we'll work with Gina to make sure we have the right links and information for that. Get that in the portal, and we'll send that out in the summary of the meeting, so everyone will be able to get to that immediately. So that's great.
So this is my first time here, so I'm not really sure how to work, but since you're talking about challenges,
Great. Great.
So we've been over the year now, and it's starting to, there's a lot that goes into that, obviously. And we're at a really good place, and then we just expanded where we're now. We went from being licensed for 30 kids to being licensed for 30 kids. And we've got 2 insurance companies that we're working towards having this one with like health. And so we're expecting to grow really quickly, probably in the fall. And so it's been quite a challenge to get ready for that. Like Nick said, our structure right now is we have that with and sentiment. And so it's been, there's a lot that goes into that. A lot of new policies, a lot of new procedures, a lot of new paperwork, a lot of new structure, and how to use all the treatment rooms, how to put the groups, how to house enough therapists, like that. It just seems like there's a lot of uncharted territory.
I'm sure.
Yeah.
So, Teresa, remind us what your organization is.
Okay,
That's fantastic. Okay, we'll talk about that in just a second. That's a great segue. So are you using QI techniques to help with the new policies and procedures?
This is the first time I've heard that particular term.
Quality improvement.
Yeah, that is what we focus on. I mean, everything we do, we're focusing on that. And how do we are very quality oriented. And so everything that we do is very stringent. Reviews, and we make sure it's all very competitive. And we have a lot of really experienced people that are helping us. So, I would love to learn more about what that term defines, how that term defines.
Okay.
I would love that because I know that we're doing it, but I would love to learn.
I think there are people in this room who might be able to help you. Great. Okay, they'll follow up with you afterwards. Well, yeah, the timing is fabulous because we were going to kind of showcase the James Mason Centers for Recovery. So if you guys want to take a second and tell us about your organization, that would be great.
We're in the land of acronyms now, so I'm looking forward to learning more. Trust me, in the mental health, that's all we do, but we were the first ones to say, what? QI? You know what that stands for? Google that really quickly.
So James Mason Centers for Recovery is founded, it's a company founded on, my son's name is James Mason, and he struggled with the types of things our kids are struggling with for a great number of years. And he had a passion for helping people. He loved to help people. It was all his own hero. He just knew that he would be a major influencing, a major player in being able to influence people that are struggling like he did. He really had a passion for that. And he passed away from a heroin overdose. Almost 2 years ago, in October. And so when he passed, we started this company in his memory. And we are very, very passionate about what we do. My goal in life is to keep kids from ever knowing what it feels like to be an adult addict. And that really is our goal. That's what we do. We work very heavily with families. We're very, very family focused. We're actually going to be implementing the Strengthening Families program this fall, which is an amazing program. If you don't know about that, that is an incredible program. We are very experiential, we're very evidence-based. Our facility is we have a really have a philosophy that we know who these kids are. You know, James went through the most difficult things and things that the world would judge him for in the most terrible way, and yet I know who he was. He was the most magnificent human being. And so we see our kids that way. And so our center is very respectful, very choice-oriented, very empowering. We really do what works for teens. That's our goal, is to reach these teens and to reach their families. And we offer stations. We have accredited schools that we offer them so they can actually build credit while they're with us. We offer, so it's, help me out here.
So intensive outpatient, which is like an after-school support program. We do a lot of experiential learning, CBT, DBT therapy. There's a number of different, and again, it's all about the power of choice. There's a lot of different options in the Valley for adolescent treatment. We're the only one that just does day treatment. And there is something extremely powerful with being able to utilize them within a group. That's where some of the most powerful dynamics come into play. And I actually came on board with Teresa because I'm such an advocate for believing that the Utah family in general will want that opportunity to help their child with going to day treatment before they've even, I mean, we've had some kids that were slated to go to residential. There was, you know, no availability with Wasatch, Summit, any other programs, and so they ended up coming to James Mason in the interim and really grasped the programming and were graduates of the program. So that's one of the reasons why I came on board with Teresa, because for the last 2.5 years, my job has been to gather all the community resources so that when families call or professionals call, I've got an answer for you. I've got some options, some solutions, a psychiatrist, some APRNs that are taking new clients. This is a group of therapists that are phenomenal. I won't refer to someone I haven't met. So when it comes to the therapists that are dynamic and work really well with youth, we're all about the community outreach and being a part of the solution, because we know that there isn't, you know, this is just an epidemic and a problem and it's not going to go away. The mental health portion is huge, and you know, if we can get them before that goes into the substance abuse, that's what we do. And we're really passionate. Again, I don't think you can platform any story when you know, I related to Teresa as a mom. I have this 15-year-old who struggles with mental health, suicide ideation. She, you know, she gave me a run for my money. I mean, cutting all sorts of things. And so to me, in my mind, that's the worst case scenario. And even though I do this for a living, I was that person at the ER with the crisis worker, deer, you know, in the headlights. What do I do? So I really have a deep respect for all of the people that work with youth, with children, adolescents. We have our job, you know, we have our work cut out for us, and being able to be a part of something like this that can bring us together and kind of create solutions where they're, you know, what do we do type problems, that's what we're all about. So yeah.
What insurance is you guys need? We are in the process of using panels with Select Health and also Aging Health.
But we can do single case agreements that will make it so that the, you know, family is not punished for working with us out of network.
And we are rarely not qualified to use coverage insurance, because between out-of-network benefits and single case agreements, because there's just not a lot of resources out there, there's a lot of waiting lists. We just have not had any problem getting insurance for our clients.
And most of the insurances don't. They want to see that, you know, they've tried a lower level of care before they're going to authorize residential. So a lot of those are really easy for us to be able to get approved.
We are just up by 4,500 staff run Atherton. It's about half a mile west of the freeway.
Yeah. So if any of you want to come and tour, we'd love to have you.
I'm just wondering what the cost is if you don't have insurance. Well, we do a scholarship a lot of our fees. If it's really just a self-pay, it's $350 a day for IOP or for day treatment and $250 for IOP. But we have never hired a self-pay person because insurance typically. Is that per day or? Yeah. So we really look for good insurance, and we just pay. We typically what we do is we take just whatever the insurance pays, and then we do the scholarship. So we haven't had a lot of concerns with having to have much out of pocket fees.
we try to utilize any resources they have also. If they've got any connections with clergy or anything, we try to help, help support the parents and think outside the box. Even if they're Medicaid and TRICARE are two insurances we don't work with. But we will try to explore every possibility that we can. If we can't, then we reach out to other programs.
How far out are you in for what if the child qualifies for a scholarship? What's the turnaround time to get to that child? We have one right now that is on a scholarship, but it's on the top of the waiting list. And by saying the top of the waiting list, you still have to wait about 4 months. So, yeah. And it's out of control. Is he uninsured? Is that what it is? Yeah, Medicaid. Medicaid, yeah. Yeah, we've talked with Medicaid, and there's just no opening, or they just don't have openings, and so there's really nothing we can do with that. But that is something that we're looking for, and we've only been open a year, so it's something that we're working towards. It's something that we do want to be able to do that.
And again, if you want, I'll talk with you later about what some other alternatives could look like, because when it comes to that population and everything, I've tried to make notes of who and where they can, they can possibly access. Also, if they've got any other families, clergy, if there's any, with LDS church, anything at all, again, we can kind of bring.
When you say you talk to them, awesome or?
Yes, awesome. Yeah. And we're open to suggestions if anyone has any clue as to how we can, because we know that is such a challenging demographic. It just is so underserved. So, we're open to any suggestions that what might.
What about the foster care agencies? Do you work with those, or do they? Because I know most of the therapeutic foster care have their own in-house counselors and stuff, but often they need more. Do you work with those children or with those programs?
Those are more the state-funded programs. We don't have state funding at the time.
Overall, the average Utah family with, working, I shouldn't even say just working class, but overall the demographic, 12 to 17, kids that are struggling with mental health, substance abuse, suicide ideation, all of the things that would, when you think of, because again, I know how a lot of it works when you're at the pediatrician and the doctor's like, okay, would they meet criteria for going to uni? Yes or no? Probably not. Okay, well then here's a list of the approved outpatient therapists. That's usually the protocol. I'd like to hopefully introduce that, if they need that higher level of care, you can always reach out to me, to Teresa, and we can at least give you some alternatives, because that's our niche, is that next step up, the intensive outpatient or the day treatment. So, and because it's Monday through Friday, 8:30 to 4:30 for the day treatment, and 3 to 6 for the end of school year for the intensive outpatient, we're that niche that's right in between something that would be, residential or, so we're not a mobile crisis by any means, but again, just think of us as that next step that's an alternative to just saying, well, here's a therapist that's in your area and you don't know anything about them, or, how familiar they are with adolescent treatment, whatever. So.
And we also can get them in pretty quickly. We have usually a 1 or 2 days turnaround. So we are really fast on getting them in.
So we'll pass out our brochures and our cards. Feel free to give us a call, and
Thank you.
Appreciate it. We really do appreciate it.
I'm not sure they realize that we're all going to call them.
I really do.
Thank you very much. That's fantastic. And yeah, they are definitely in our database. There. Great. Okay.
So I'm just going to pass out some of the brochures and then our business cards, and feel free to give us a call.
Anyone else thought of anything in that time? We'll go ahead and move into our next part of our meeting. Quickly remind anyone about motivational interviewing, anyone using that? Is that going? Open-ended questions?
Children's home.
Yeah. Okay, so we're going to talk a little bit about the medical home portal now. And thank you to those of you who brought your devices. If anyone needs a laptop or something like that, I think we have a couple of extras. So, you guys have a tablet. Are you good, Hannah and Evan? Okay, great, fantastic. So, that was terrific. Okay, so we don't need to jump in quite yet, but I will preface if you want to be thinking about it, that you will need wireless. And the wireless information is up here at the UCCCN network. And the password is welcome1, and that's with a capital W. And we'll go over that again. We'll make sure everybody's connected. So I am actually going to ask for Dr. Norland and Gina to talk a little bit too, to make sure I don't forget anything, because they'll get to come up here in just a moment. But basically, we wanted to take an opportunity, take a month, take a meeting, and talk about the medical home portal, which is something we refer to in every meeting, but we realize that we don't often just actually try and explain the bigger picture about it to you, and actually the overall site. We focus a little bit more on the services directory, and we often don't really point you to some of the really in-depth content that's there and some of the other features, and we want to make sure that you're aware of those. And also kind of give you a little background, give you a tour. So the medical home portal got its start in a medical home implementation project back in 2001, and even got its start prior to that because of a survey of Utah pediatricians that Dr. Norland did in conjunction with the Bureau. And they asked the pediatricians 3 questions, and they got kind of really similar answers that came out of those survey questions. And the questions were, you know, how can we, well actually it was one question with 3 answers, 3 top answers, and how can we help you improve, what would help you improve the outcomes for children with special health needs and their families? And so those answers were to have a care coordinator in my office, surprisingly, back in 1998. And the second was to have access to up-to-date best practices for some of these chronic and rare conditions, to really be able to quickly get access to that information that's been, you know, approved and vetted where it's available, where it's possible. And then the last was to have access to local services and resources information to be able to connect these families to the things in their community that they need. And if there was a way to understand all of that, that would be incredibly helpful. And so Dr. Norland felt like probably couldn't get care coordinators in their offices himself necessarily, but he could possibly help with the other 2. And so a resource guide was the outcome of that particular project, a printed one, and very quickly they realized how that is out of date almost immediately. And there was this great thing, the World Wide Web, that was happening, and they said, well, let's give this a try. And so the first version, first iteration of the medical home portal website was born, and it evolved over time to being something much more robust than it was initially. It can be a bit of an overwhelming site, we know, and that's the other reason that we wanted to give you a little bit more of a demo today, a little more hands-on. So I just said that, so we'll go on. Kind of said that. Okay, so now we'll actually go to the site. So medical home portal, medicalhomeportal.org. So this is our main homepage. We actually work not only with Utah service provider information, but also we provide information for Idaho, Montana, and New Mexico. And we've got Rhode Island, who has data in their own database for the medical home portal, but we don't have them in our list because they're just about to do a big rollout. So you'll see them showing up in this list here in the next couple of weeks. And we look forward to finalizing an agreement with Nevada to do the same. And Rhode Island, we're trying to figure out how to make sure that that shows up on our map. So if you have any ideas, let us know. Nevada should be fine. And so we're really excited about having Nevada join kind of our Intermountain group over here, because we know that patients do often need to cross, you know, state lines to get the services they need. And so we often work with 211 organizations or other kinds of organizations that do information and referral on community service providers. And so we work with Utah 211 here in Utah, and then we also do our own efforts to gather professional kinds of data, which might be subspecialists, therapists, and mental and behavioral health providers, dentists as well. So we do that kind of in-house, trying to gather and maintain that data. Chuck, do you want to come up and talk a little bit about kind of our more clinically oriented areas of the support? You'll see these two on the left of our big navigation bar here. And so I'll click diagnoses and conditions. And see if you can figure out this. Okay.
Figure it out. So one of the key rationales for what we for goals that we had was to help primary care clinicians better care for kids with chronic and complex conditions, recognizing that many of the conditions that we need to manage in primary care are conditions that we rarely see. We might have 1 to 5 patients in our whole practice who have that condition. That's over the entire age range of pediatrics. On this page, we call the diagnosis prevalence list. It's listed a bunch of those conditions, and I'm sure all of you are familiar with the ones at the top, like obesity and ADHD and headache and asthma. But as you work down your list, and point out that in this column, it calculates the number of patients in your practice who would likely have that condition. If you know the number of patients you think you have, you can enter it in this box and click change size, and it'll calculate. And don't consider this to be precise, one, because all of these studies on which the numbers are based are done quite differently. So, but it's just to give you a ballpark of how many patients you might expect in a pediatric practice. So as you go down the list, you know, the numbers in that column get smaller and smaller. So even something we think of as pretty common, like seizure disorder, you know, busy pediatrician might have 10 patients with seizures. Cerebral palsy, another common chronic condition, 5 patients. Diabetes, only 4. Down syndrome, the most common chromosomal abnormality, you know, 3 patients. So these are conditions that we need as primary care practices to be able to take care of and do a great job of, but we don't take a lot of practice doing that. So the reason for, or one of the reasons for us compiling this was to be able to provide clinicians with ready access to the kind of information they need to do that. So by no means is the world complete in that, but we've got about 48 diagnosis modules that are aimed to provide that kind of information, sort of just in time when needed, and really focused on kind of the primary care needs. And I'll just show you very briefly one of our example modules. So this on autism. They're all structured the same. They try to provide some brief orienting information about what are the ICD-9 codes that are relevant, or ICD-10 now, a description, what's the prevalence, what's the genetics, what's the prognosis. So these are all key questions that parents are interested in. Primary care clinicians need to be able to respond. What's the role of the medical home? What are the guidelines for caring for those kids? Listing a few helpful articles. And then how do you go about clinically assessing such patients, both in terms of screening for the condition or family members, how do these kids present? Some of them can present quite subtly. And then what are the diagnostic criteria? What are the differential diagnoses? What are the conditions that you need to think about when you're considering this diagnosis for a child? What are the medical conditions that might cause this condition? What are the comorbid conditions? That is, what other conditions are commonly found in kids with this diagnosis? We include pearls and alerts, and those are the kinds of things that only the subspecialists who see lots of these kids would ever be able to find in the textbook. Or the alerts are what does everybody need to know that you could find in the textbook and might not go there. So that we try to compile a few of those for each diagnosis. And then go into detail on what would be important to include in your history and physical exam. And then we have a section on treatment that includes, well, how should common problems be managed differently in kids with this condition? Because that's where primary care practices ER calls or patient shows up and you have this, well, in the average kid I would just do this, but is there something different I need to think about for a kid with this diagnosis? And then we divide the treatment section up into systems, and systems include not only body systems like neurology and pulmonology, but also systems like learning, education, school, neurology, etc. And throughout here, we include in each of these sections, as well as in the clinical assessment section, what are the subspecialists or other resource collaborations that you want to consider. So, for example, here we have psychiatry and autism clinics are listed. And then in each of these, then you can link to, using that link to these services, that'll link you to a list from our database of services in your area or in your state that then provide those kinds of services. And then at the bottom of each module, we've got some frequently asked questions. Those are the kind of questions that subspecialists get asked by primary care clinicians. And then we list a lot of other issues, kind of one single pages to go into more detail about specific components of that. And then an extensive list of resources that are mostly other websites that provide good information. We annotate each of those so you have some sense of, well, is it worth clicking this link? Click it and try to figure out what I'm doing there. And we do that for both clinicians and for families. And then we also list clinical tools. So those are things like assessment instruments, data collection tools, guidelines, patient education materials, toolkits, and other things that can make it easier to do a good job in your practice. And then a lot of information and support for families. So we have a family diagnosis page where we have the frequently asked questions from families to primary care doctors, specialists, as well as links to other websites, again annotated, and then links to support groups, both national and local. And then links to studies or a link that gives you information about studies and registries that patients might be interested in, particularly for those more rare conditions. So we think that this provides, they're never as short as we think they ought to be, because primary care docs have very little time to do this, but because they're structured, we think in a way that primary care clinicians think, it should be easy to find the thing you're needing right now, whether you're in with a patient or whether you're thinking about this the day ahead of time or after. And then we also have a section on newborn disorders. So all of those disorders that are screened for in newborn screening programs. This section provides orientation, again, to primary care needs relative to that. So for each of these 30-some conditions that are screened for, if you click on the link, then you go to a much shorter page than the diagnosis module that are focused on, well, what do you need to know as a primary care clinician when you get that call from the newborn screening program saying one of your patients has a positive test. So in here, again, we provide some orienting information, what it's called. And by the way, all of these are very rare. The most common of these is phenylketonuria, and a primary care doctor on average would have, I think, 0.7 patients with that condition. But these are all very uncommon. So again, talk about prevalence, inheritance, how is it tested for? What are the clinical characteristics of a child with that condition when they present? So how do you assess this kid to see whether it's urgent that we get this kid now, or whether you can just take our time. And then what's the follow-up testing? What's primary care management? How do you collaborate with subspecialists? And then again, more resources to find out more information. So those are kind of the things that we've tried to do on the clinical side to enable primary care practices to better understand and care for kids, and particularly to collaborate with subspecialists and with community-based resources in providing better outcomes. Is that what you want?
Yeah, definitely. Does anyone have any questions for Dr. Miller? Great, thanks, Chuck. So, one of the things that I've noticed, perhaps, is that we don't often dive into, for instance, a diagnosis module when we're talking in our brainstorming sessions, because that would probably take up way too much time. But we would encourage you to check out these sections, probably particularly this one, because there's a lot of great information that will help you, we hope, as a care coordinator, perhaps not directly with the families, but perhaps to providers you're working with better help those families. And as Dr. Norland pointed out, that within these modules, there are links back into our service directory to help you more directly pinpoint any service providers that really can help with that specific condition or diagnosis. So wanted to make sure we kind of connected those dots for you. All right, Gina, I'm going to put you on the spot now. So Gina, of course, is the director of Utah Family Voices, which is Utah's Family-to-Family Health Information Center. Every state has one. And in Utah, as in some of the other states, the Family-to-Family Center works with the Parent Training Information Center as well, and that's why Gina happens to be housed in the Utah Parent Center area. And we have worked with Gina, and Gina has worked with Dr. Norland for a long time, basically since the beginning. And so the For Parents and Families section, she probably knows more about it than anybody else. So that's why she's going to talk with you just a little bit about what's in there and how it got to be and why it's structured the way it is. And he's going to come around and give you a handout that actually shows you all of the pages in the For Parents and Families section. It's our largest, and so often those pages are hidden in that left-hand menu, and you may not realize what's in there. And this is something that we hope you'll become more familiar with and point your patients and their families to as support and education and information.
So realizing that with the medical home portal, especially in this area, it's always a work in progress because we had a bunch of families kind of elaborate on when they were searching for information when they were very first diagnosed, including for my children. I kind of thought of that logical step of, because we all know, as much as we love our medical homes or pediatricians, care coordinators, we do have this relationship with Dr. Google. So we are trying to figure out how to get credible information in a site where families can go, and then even if the information is not directly on the portal, there's an overview, there's general information, but then there's links to those sites that we do know that have been vetted and they're credible sources. And to give you an example of one that very often gives people a little bit of heartburn is complementary and alternative medicine or therapies and such. And so we have a section in here that has been developed in collaboration with physicians and others so that, when families are starting to look at that, because we as families are looking at all of the pieces out there to try to get the best help and best services for our children. And I have it pulled up. It's after caring. So for example, here's the one on CAM. And it goes through kind of the different pieces of CAM as well as giving some suggestions on and those of us that have children that are on the autism spectrum know that there's many out there with what we families refer to as snake oil. We're so willing to buy into everything just to see if we can make a difference. So with the information, we wanted to step back and say, how can we, from credible information vetted, give them a heads up on what to look for and such. So that's one example. The other piece that, as it was structured, we were kind of starting out if you're just starting out, and a lot of the new diagnoses are in early childhood. So it really does start out going through the beginning, and we realize that many are diagnosed later, but hopefully it can be where you can jump right in. And we're finding that even for families that go here, it's very overwhelming because there's so much information. And so we're trying to figure out through when we all go to search and when we have other families search, how's the best way, and they're still saying, we still want one site that we can go, and it has kind of a clearinghouse of all the information. So we are still meeting the goal. The piece that we're trying to do, though, is how to highlight some of these other pieces so that they can dig down far enough and get to some of that great information. A lot of the calls that we get here for the family-to-family, and I know that a lot of the calls that when I'm working with Maryland or the integrated services, they're always looking for providers. But mental health always comes up, guardianship, and then, of course, funding, whether it's health insurance, whether it's Medicaid and such. And so that is one that we, again, it's always a work in progress, that we're trying to get the most information out there. And we may just have the overview with the key points that families, professionals need to know, but then we're linking to that site where they're actually going to get the best information for their situation. The other pieces that, as we were going through, starting out, everybody, we never realized how many terms mean so many different things, like early intervention. For me, I was just automatically thinking early intervention, the Baby Watch program. You know, that's what children 0 to 3 go into if they're eligible. Well, we didn't realize, like with mental health, early intervention, that just that term means something totally different. So what if you have a child that doesn't meet the criteria or eligibility for early intervention? How are we still talking? We still want to intervene early for some of these pieces. And that, I have to say, was probably 6 months worth of meetings trying to figure out how just to title that. And so we started looking at early services so that families like mine, when you're just starting in, okay, I'm not eligible for this, but what is there? And so we do have information on there as you start out about some of the other programs that may be very, very beneficial to families, such as like early Head Start and such. And then really what's important that I think for a lot of our families that we forget is the caring for the caregiver. We as families put everything into trying to take care of our family and our children, and so we have some great pages in here. If you've just got parents that are coming in and are overwhelmed, there are some pages about taking care of the primary caregiver, taking care of the married, and one of the most important pieces is there's some information in there on siblings and how siblings are in the mix. And I always talk about with my children, the siblings of my children with special health care needs, how it was always that unintentional neglect because we're always dealing with crisis modes and such. And so when really going through this and looking for some of the content in the modules, that was so important to many of us families because we want the siblings that is their a key piece in the day in the life of families with special health care needs. And there's also a piece on fathers of children with special health care needs or special needs. And some resources. The one thing is they have the overview, the content, and then we try to give, again, those key credible resources. Not saying that it's all inclusive, but we're at least between all of us, Kay, Mindy, Tina, that works here at Family Voices, is making sure at least as much as we can that there are always live links and that they are ones that we would refer our own families to. Anything else?
So on your handout, there are, I think, 4 of these that are highlighted. I don't have the highlighted version, but hopefully you can see that the care notebook, the CAM page, the respite page, and there was one other, 2 on each side that we actually have specifically highlighted that might be ones that you wouldn't have thought about that are in there. Of course, we think that all the pages hopefully have some value, specifically for whatever the family is going through at that time. And we love feedback. So the medical home portal is intended to be, the safe resource for children with special health care needs and those who care for them, families, providers, etc. It can't meet those needs unless we know where it's deficient. So we love hearing feedback. It won't hurt our feelings. When you're looking at it and you think that something's missing, something's incorrect, so on, if you let us know, that means you were looking at it, and that's fantastic. So we love
It may hurt my feelings, but that's
we'll act as a buffer before I get to see them. But, so there's a feedback link in the footer of every page, and of course all of you know how to get in touch with me and with Kay. And so those are great ways of letting us know if you have any thoughts. We love hearing good, bad, all of it. So we would welcome your thoughts on everything.
The only thing I was going to ask, because I do work with so many people of different nationalities, different languages. Most of them do have case management for a short period of time, but for this parents and families resources, do you have other languages available, translations for them?
So currently, what is available, and I know that some people turn their eyebrows down to this, but it's the Google Translate.
Okay.
And, but we are starting to, we've talked about this as well, because there are some great resources that have been developed in other languages, and trying to figure out how to get those in there to be able to navigate to them, and for the families too, if they're looking on their own. The one thing I did want to say is sometimes you'll say, well, that was such a quick overview, and we really in this want to be able to gather all of this great information and these resources out there, but not, duplicate or recreate the wheel, because like on special education, every state has a parent training and information center that is directly funded from the Office of Special Education at federal level. All of the materials go through a vetting process, like through each state, like our state Office of Education, which is now the State Board of Education. And so that we don't want to put all of their information on there because they've already got it there, but we want to put those key highlights there. And in some of those cases, when you would link to, say, you want to know a little bit more about sections like before, but Spanish is probably one of the, where we have the most materials and such. That side would have definitely some materials in Spanish. And so it takes a little bit of digging, which, we're hoping to get to the point where there's not so many clicks in any website, but it does take a little bit of digging. The one thing I did want to point out is that on some of these key pieces, there's always an overview. So you can kind of see what's in there and directly go to that information. So if you're looking for guardianship and such. And then on the care notebooks, I think that's another key piece. In some of the support groups that I've been presenting at, that has been what we have been talking about the most. And for different populations, of course, they don't want the whole care notebook. In the medical home portal, you can just pick pages and they can develop their own key pieces, because with so many emergencies happening and we're talking about, this is really, if you do a care notebook, this is kind of the blackboard or the directions to your child, so that in the event that the primary caregivers cannot be right there, there's that vital information that somebody needs to know about your child, even if it's how you approach them. Right, right there. And so we have gotten a lot more families to start thinking about it not being so overwhelming and such. And so that, I think, is a really, really good resource. If you look at anything at all, the care notebook would be a great one to look at.
Yep, that's fine. All right. So there's a couple of other sections that I'll show you just quickly on the portal before we jump into service provider list. So we've got the for physicians and professionals section here. This one's actually probably one of our shortest, but it is growing as well. So we have some information on building a medical home, about care coordination, children and youth special health care needs. Really, this is what you guys are doing every day. And then we have a page that's specific again, just a little bit of an overview here. We hope that we'll be able to add some other pages with our partner states in here as well, knowing that they are working on the same kinds of things. For our common issues, we're just getting started with this, but we're pretty excited. We have a number of other pages in the works for this section, including, I believe, GERD, and I think we've got a puberty one coming, and possibly one about sexuality. So we've got several coming up that will really function, to look at these things that every child's going to need to go through and how they might be different for children with special health care needs. We've got a little bit of information kind of from a professional point of view for regarding education in schools. We're looking to add to that. We have a section specifically around feeding and nutrition that we'll continue to add to. The formulas page actually has some pretty in-depth information. I've mentioned that, I believe, before at this meeting. Where we're aware of health supervision guidelines, we link to those. And then we have a number of pages under medical technology. Our feeding tubes and gastrostomies page is actually one of our most hit pages. So several information on kind of maintenance, oral tubes, oral versus tube feeds, different types. So could be useful for this group. And then feeding prevention, we have a number of pages that talk more specifically around screening, and we do have a little bit of prevention information on our childhood obesity page there. You have a page around autism screening, maternal depression, which was recently updated, oral health, TBI as well, hearing, developmental screening there, and toxic stress. And we have some information on transition issues, again, from kind of that provider physician point of view. So yeah, watch for that to continue to expand, and if you have ideas or topics that you would like to see us develop, these are typically, more focused and shorter and easier for us to develop and then maintain than, for instance, the diagnosis modules, which are very, very in-depth. In our other resources section over here, you've seen some of these things show up in the content pages. So our information and support links, those are really those links out typically to other websites. Sometimes they're to a PDF or other kind of downloadable item. They're vetted, and this is a way to actually just come in and search for one that perhaps you saw, or you're not necessarily needing to look at a specific topic, but you have an idea of the link that you're after. You can come in here. Patient education, those tools for the practice that Dr. Norland mentioned, registries and studies, and then anytime we cite any evidence, we have a bibliography for that. So you can go and look at a citation or article if you're interested, and so you can actually just search within here. All right, so now let's talk about the services directory. So this is where the hands-on interactive part comes in. And so do we have a couple of people, Gabby, on the phone?
We have Carly and Kate on the phone.
Right, Carly and Kate, we will do our very best to include you in this. Please don't hesitate to maybe type something in the chat box if you have a question, and we will definitely try and get to that so that you're included in this as well. So has everyone been able to successfully connect to the wireless? Everyone's good? No one needs any help? Perfect. Great. Okay. So Carly's on screen. So on any page in the medical home portal except for the home page, you will now see a little link on the top right that says My Guest List. And this is an easy way for you to start working on a list of service providers. So I'll just point that out. I will quickly, although I think many of you have seen this before, kind of scroll down through all of our many categories in our services directory. So this is one way that you can kind of get a quick look at what's included in the Utah part of the services directory database for the medical home portal. So it's pretty extensive. We know that again, can get a little overwhelming. You have up to 3 levels of categories within a kind of a topic, no more than that. And anytime you see a number to the right there, that indicates the number of providers that we have in our Utah database for that category, that type of provider. So really extensive. and we work with Utah 211 to get quite a bit of this information. They are the designated organization for the state of Utah to pull together the Health and Human Services kind of nonprofit or state-funded types of service providers. And so once you're in here, if you're interested in creating a list of service providers, perhaps you want to do this for a particular family who has come to meet with you and they have several needs, and you want to help get them to, directly to organizations or service providers that you believe can help them. And so perhaps you're going to have a list of 3 or 4 that you want to create for them. Alternatively, one way that we've thought about using this might be if you refer to providers quite a bit in your practice, you might even want to compile kind of a default list that you can print and hand out or have ready for families to come to your organization. And the nice thing about these lists is that they're very quickly and easily modifiable. So if you've got that default that's ready to go there and you want to customize it for a family or for a particular setting or situation, you can do that. So I don't know what might work for you guys, but if you want to kind of come up with an idea that might help us with this exercise. We did ask that perhaps you bring your own list, and if you'd like to take an opportunity now to try and recreate those, that would be a great time, because Kay and Gina and Dr. Norland and I are here to walk around and give you any help that you might need. But one of the key things that I want to talk about before we necessarily get into it is that to really do the most with these lists, and you might be able to see these grayed out buttons here, kind of a little bit hard, but the reason that they're so gray is that I can't use them right now, and that's because I'm in the guest list mode. To truly utilize all the features that we have around lists, you need to be logged in. And so we have it's a very simple process to register and have an account on the Medical Home Portal. It asks for your email address and a password that you choose. It's got to be at least 6 characters, but that's all. And for some of you, I've created those already if I knew that you were going to come to this meeting. And some of you actually already had an account that was in place, so you should hopefully remember how to log in with that. So I'll just mention really quickly that Carly and Kate, I set up accounts for you, and Jan, Brittany, Colin, Margaret, Marilyn, you already have one, Rebecca, you already have one, and Patricia, you should have them set up already. And if I didn't say your name, you may not, and you'll probably want to go through that part right here. The only reason that might be a little tricky is that you do need to verify you are who you say you are by going into your email account and clicking a link in an email that we automatically send you to register for the first time. So that might be something that you'd like to do now. And for those of you who I set up new accounts, it's your email address that we correspond with you for UCCCN. So if you are a CP to me, it's the email address that you use for that. And then your password that I will ask you to change is my list, all lowercase, all run together. So my list. So if you want to try and do that, the way to sign in is to either click these 3 little dots on the right side of that guest list link, to click here where it says please sign in or register here, or to come up to this top right-hand link in the corner. If you click the sign in link in the top corner, it will take you to the page that lets you both register or sign in. So if anyone has any questions about, for instance, how to get to your email on the web, I might be able to help you with that. So if you're going to be a first-time user, I'm going to make up an email address, and I'll show you what it will look like. So I'll register, and it says that a validation email has been sent to this, it was your Utah one.
What is the password again, please?
My list, all run together lowercase. Yeah, Kate, try it. Yep. Yes, Kate, that was the one. Okay. anyone need any help? Don't be shy. This is our interactive part. You can talk, you can have trouble, we'll figure it out. Okay. All right. Okay, very good. So if you wanted to, well, there's a couple of ways for you to go back to the list link right there. My space list is probably good. You click on that. Then what it's going to tell you is that you don't have anything in there yet, but you can click on the services directory. You can browse to any providers in here, and then you can see some options up there. So just click on a little star, and that will add it automatically to your list. So we'll do that. Yeah, we'll do that in just a second. I think everybody's okay. And how are you doing?
Mark, are you able to log in?
Okay. Do you
Are
know
you able to?
I'm waiting for my validation email.
Oh.
So, yeah,
It's not come yet.
Mine came right away, so.
I'm waiting for mine.
Oh, here it is.
All right.
Are you in?
So some of you will be here.
Oh, it's like Margaret. Okay.
Okay. And so if you're here, so this list is empty. So this is our opportunity to start putting things in. And don't worry if you're not there yet. We'll come around and help everyone individually. So you can click on the services directory link. So that's linked here or up here. And you can then search or browse to get to a specific record. And then there'll be a little star option next to that one. And that's how you can add it to your list. And once you put that star, you'll see that a number will appear up here that indicates you've added a service provider. So let's do that. So this is your chance to hopefully create something that will actually be of use to you. So if you want to just mess around with it, you can delete these, you can modify them, you can rename them at any time. But if you want to, this is a great time to think about, well, what kind of a list would be helpful to me? So we hope that you'll do that. So for purposes of demonstration, maybe I'll come in and look for respite care. And perhaps I'm going to be looking in the, let's say, Midvale, Murray, South Salt Lake area. So I can see that I have a number of options right there. So I'll start with Midvale. And Salus Home Care apparently does respite care. So I will expand this record so I can see a little bit more. Licensed pediatric nurses for children with special medical needs. Okay, let's say I like this. I'm going to add it to my list. And of course, you can do more research before you do that, but I'm going to speed the process up just a little bit. So I've clicked the star that goes along with respite care. You do more than just that, but that's the thing I'm interested in now. And you can see that this is saved, and my guest list has Will Provider 1 in there. I think that was a little bit of a strange artifact in there, but I'll ignore it for now and we'll watch that. So in Murray, it looks like we've got another organization, the Cottonwood Adult Day Center Neighborhood Health Association. So let's take a look at that. So supervised care during the day. So perhaps this is relevant for me. Maybe my child's 18, and so I'll go ahead and click that one. And you can see that the background lights up. So now it's yellow. That shows you I've selected it. And I have 2. Yeah, I do see a little bit of weirdness that we'll investigate. But I think we'll focus on the fact that I've got 2 providers in there now. And maybe that's enough. So if that's the case, I'm going to come back to the actual list where I've got both of my respite care providers right here. And now, if I want to do anything more with this, really do it, not just sort of halfway do it, because I could, in fact, share this link right now if I want to. And somebody else could click on the link if they receive it, for instance, in an email, and they would go to this page. They, again, wouldn't be able to do much more than that. But it does work. So that's something that if you don't want to sign in, if a family wants to come and mess around like this, they're very welcome to. But if you want to do a little bit more, this is where you would do the signing in part. So I have an account, so I will sign in. And now it tells me that this list belongs to me. And you can see that these buttons are now active. So by default, This is a link that I could share and people could see it and they could see the name that I've given it once I do that, if I want to do that. And if I don't want to share this list, and I may not ever send the link, so this may not be an issue, but if I really want to keep it private for some reason, I could do that by saying unshare. And now this is private. So that link isn't available to anybody. If they went to it, if they found it somehow, I don't know how they would, but if they found it somehow, it wouldn't show any information. It would have a little message that says this list isn't available for viewing. So, but the whole point of these, we feel, is that if you can create these for families you work with, for care coordinators you work with, other people in your medical home team or your organization, we want to make it so that these are accessible and available. And anytime we update the information that happens to be in your list through an update to our services, your list will reflect that. And therefore, someone who has been shared that would also get that update. Chuck, you look like you have a question. You're good? Okay, great. All right, does anyone need some help? Is this making sense? Okay, great. So I'm going to go ahead and name this. I'm going to say respite, and I'll say Murray. Maybe respite providers. Now we would really encourage you not to put any family names, any patient names in here. If there's something that's kind of general that will help you remember, that would be great. But we don't have, it's a secure server, but we really try and avoid any PHI on our site. So we would encourage you to look at this a little more generally. And if you can find ways that will help you remember why that list was created, if it is for a particular patient, that's the best way to go there. Shoot, I had a thought and I lost it.
I have a question.
Yes.
So I make my cool list,
Okay.
and let's say one of those resources has been pulled out or no longer exists. Does Medical then update our list timely then? Does
Right.
it come to our list and, say this is no longer available?
That's right. That's right. Yeah. So to be honest with you, I don't know exactly how it would be reflected right now. We're generally speaking aren't getting rid of providers. What would potentially happen is, like a telephone number would change and it would be reflected in the
Okay.
The pay that's right. Change its address.
Perfect.
I think it would be.
I'm sure it would be removed whether or not there would be a notification. And so that's part of it. I'll just let you know right now, and this is where your feedback also comes in. This is an ongoing project of ours. So we plan on making a lot of changes and improvements, hopefully small, some that you may not even notice, but they'll make your life easier, like we'll get rid of those additional little guest lists that kept popping up. And others that we'll need to explain to you because we're going to try and improve this. And your suggestions will help us to do that. So we would love, as you're doing this, to hear from you, really to hear from you. The other thing is that one of the things we believe would be useful, and you can help validate this or not for us, is to have somewhere on here, when you're logged in, to annotate these providers. Perhaps you know that they do a certain thing but not other things. Perhaps you know that they're not taking a certain insurance right now. And that's not something that we have the ability necessarily to maintain. We would love to, but I'm sure you understand what a job that would be. If you, though, could keep that information for yourself, perhaps you know that they work really well with a certain age group or a certain, even though they're, on their website they might say 0 to 18. Whatever it might be, would that be useful to you to be able to go in and make little notes at, for instance, the record level, provider level, and then perhaps also to explain somewhere not in the title, but at the top of the list why you put this list together? I think for me that would be extremely helpful. So that's one of our very near-term feature improvements on here. So those kinds of things will continue to improve and add. I don't think we knew how hard these things were going to be when we got into this, so it's taken us a little bit longer than we thought with really great programmers working hard on it. But we are going to continue to improve them, and so what I'd like to ask for you guys here today is I'd like to kind of give you an assignment, and that is to not only make a list today, or perhaps you don't quite get all the way through, but to go back to your office, go back to your environment where you would usually be working with these patients and their families, and do something with the list beyond just making it and naming it and walking away. So that might be printing it. You can save it as a PDF. I think most of you know how to do that within a browser and then print, or you can just print it. You could make kind of that default list and then modify it a little bit. I would encourage you to try and send it to somebody. Maybe send it to someone you work with. Maybe send it to a family. So take a couple of steps. Actually kind of go through the process, and then I'm going to come back to you in about a week, and I'm going to ask you, how did it go? What was your experience? And that's where we'll really look for feedback. And it might be a reminder to you, and then that might be when you go and do it. But that's fine too. If we could really actively ask you to engage with us to help us see how we're doing. Is this something that you could use? Is this something that we can get to a point where it could replace whatever you're doing now for this? That is our goal. We want to make the medical home portal that one-stop shop for you. And the medical home portal, I don't know, some of you do have tablets, so hopefully it's working well with them. But it does size down depending on the screen size that you're on. And the idea is that it's mobile, right? It's mobile for families. If they want to take that live list on their smartphone and be able to find the address and remember where they're supposed to go, add to that kind of in real time. That's our goal, is to make it a useful tool. And the best way for us to do that is to hear from you why or why not this is working for you. And we want you to be real. If you've got something in place, whether it's a physical binder, whether it's Google Docs, whether it's whatever it is that you're currently using to keep your own resource information, and we know that you're doing it, we know. How can we more closely do things in a way that would work for you? And we'd love to hear that. And I'm all ears now if anyone's willing to volunteer that information, or you can tell me like more privately. Yeah.
I just have a question. I love it. If there's someone that's on our list,
yes,
not in here, can I add it to this list, or we can just keep one list?
So yes, that's what we want. Now, currently, we don't really have an interface to just stick a provider right into the database. We would want to do a little bit of checking to make sure that we put in the kinds of information we want. We would go to the website. We would do that. So again, that feedback link, so it's right here.
So we need to go through.
That's right. I'm afraid we don't have that now. And I like that idea. One thing, we don't want to miss any information that's not currently in the database. So if you want to put something on your list that would be of value to other care coordinators and others caring for these kids, we would like to make sure that we're aware of that and get it in. But again, we want to make these lists work in a way that's valuable for you. So if it fields that allow you to put additional information in there, yeah, we want to do that. It's just not there quite yet. But please, that's a really important point. If you're looking for a provider that's not in our database, that you know exists and you use, please let us know. You can email me or pay directly, or you can use this feedback form. And you don't have to give us too much information. We'll do the checking. But that's hugely helpful. If something's out of date, sometimes with those professional providers, we haven't had an opportunity to get an update in a timely way. In other cases, maybe 211 hasn't had a chance to, or we haven't updated from 211 recently enough. We love hearing from you. If we're all working together, we can provide such a better product and do a better service for our families. So don't ever hesitate to get in touch with us. We love hearing from you.
Tell me your relationship again with 211. So if they update something, does it automatically come to the medical portal?
Not yet.
Okay.
So currently we just get a big fat file from them,
Okay.
and then we look for differences in that file versus what's already in our database. And so when there's a difference, we pull in that information.
Okay.
If it's new and it meets the criteria that we have for, the types of providers, we'll pull that in.
Okay.
If it's gone from their database, then we'll get rid of it.
Well, that seems like a lot of work.
You are right. It's a lot of work.
There's so many resources that it's like, it's almost overwhelming.
It can be.
So,
And that's why we hope that the list physical health. And eventually, we'd also like to have some kind of default published lists around certain conditions. And they might have an age range in them as well. They might have a zip code associated with them, so you could change the zip code and have a dynamic list that's right there ready for you based on, autism in St. George. So that's, again, another one of our goals. We have a lot of goals.
Really quick, I think it'd be really helpful with the age thing, because there's a lot of adult facilities with adolescent, and the whole age thing would be super helpful.
Yeah.
And then the categories, if it's acute versus residential versus day versus IOP. Because that's usually, if a crisis worker says IOP, most of the time parents don't even know what that is.
I'm sure you're right. Okay.
So
that is helpful. Okay, so that was
those categories are what they usually will say upon discharge of what they recommend. Like even acute facilities,
right.
the acute psychiatric facilities are different from ERs. Like the ERs will usually refer to one of, well, there's only 4 acute. If someone tries to commit suicide, they're going to usually be blue sheeted to go to one of the 4 acute. So being able to go and say, okay, this is, and some of them don't have, and then some of them don't have adolescent units. So
using the terminology that's being used by the providers,
right.
the insurers, and families themselves, having that consistently in those kinds of provider records.
it just might help when they're looking to refer.
Okay, I think we'll be.
Oh, okay. Okay.
Yeah. 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 And then name it here. And then if you ever want to rename it, you can do that as well. All right, so remember, I'm going to be following up with you. And if you have any questions at all, this is what we're around for. So we'd love to help walk you through it. So how did our folks on the phone do? They okay?
Quiet.
Great. Very good. And so if you guys will recall, we send out the summaries of these meetings, and we always, any of the resources that were discussed in the meeting around a case perhaps, or new ones that we're aware of, we always include those in that email, and we create a list, one of these lists, and we link to it. So be aware that if there was a case that sounded like it had some great, service providers that were discussed here, we'll include those in one of these lists that you can then access. You can copy and rename it and modify it if one of those providers wasn't something you were terribly interested in, but perhaps the other 2 or 3 are interesting. You can do that now and start to add to your list, and then, of course, you'll have a list. I have a long list.
I don't see anything counting you into Basin area when I've been looking through your service directories. Do you have anything from out there listed?
I feel confident we do. It might not be under Uinta Basin, but we do by city right now. So.
Yeah, I didn't see any of the cities from out there. I just wondered because I do work with Indian Health, the Ute tribe is out in Fort Duchesne and have a huge community out there that's like 3,500 people. Okay. And we are going to be working with those people too. So I'm looking at do you have stuff available? If you don't, then I could possibly help you find that.
Great.
Because we do have resources out there.
That's wonderful. We'll follow up on that, and Margaret, I'll probably contact you offline. So
Possibly.
Great. Wonderful. Okay, we're just getting to the end of our meeting. So I know you guys have been hearing from me quite a bit about a fall learning session. One thing that we realized we didn't ask in those multiple emails you've been sent, and thank you all who responded, is whether or not this learning session would be an additional day in a month, so that we would have our regular meeting and a learning session. So I'll just ask you quickly, those of you in the room, when you received that email, were you thinking about a learning session being in addition to our regular meeting? Is that something that people would be willing to try and do? Okay, great. The other thing I will just mention is that we have had kind of a general tendency in our responses to say Wednesdays, so the majority of people said Wednesdays are best for them. And I know some people said exclusively no Wednesdays, so I feel terrible about that. But we've probably will end up doing it on a Wednesday. And the topic that got the most votes was the improving outcomes of pediatric care coordination. So that's likely to be what we'll focus on. But more details coming on that. I think we're looking at October 5th right now, but it's going to be dependent on finding a central location. I don't think we'll try and do it here. I think we'll try and do it a little more south for more of our south. But again, right near the freeway. So that's our goal there. And our next meeting is on August 17th, and we are going to have a mental and behavioral health focus on that one. We're still working to put together who we're going to be having present or be part of the discussion. And we're actually talking about doing a follow-up one in our September meeting as well. So 2 meetings focused on mental and behavioral health. One that might be looking a little bit more at some of the state and Medicaid types of opportunities, and some that are going to be looking at a little bit more what you might experience on a day-by-day basis within your own organizations and how to connect various families to what they need. So that's what we're working on now. So it'll be here on August 17th. Great, it's 10 o'clock. Thank you, everyone, very much for coming, and grab some more food on your way out.
And also, if you don't know, I need to give you a parking validation to get out, so they don't charge it. So,
even if you didn't get a card,
even if you didn't get a card, I can give.
No cards available.
Thank you, everyone.
Can we leave some information to